Okay, remember the common tools that I said we are going to use is the forceps, the needle holder, the hemostat to arrest the bleeding, and the scissors. So we are going to demonstrate two common basic types of suture in the surgical area. The first one we said is the simple interrupted pattern. First of all, we have to know that in any suturing area, we have to make some type of two knots. The first knot depends with the type of suture that you are using. If this is the non-absorbable suture, you are going to make 4 to 5 pattern. So the simple interrupted suture, you hold the needle like this, put it in between with the needle holder between the entry point and exit point. You hold it like this and you count between 1, 2, 3. Then you, for the few centimeter, you fold like this. The second count 1, 2. Then you hold that. The last one 1. So you use the scissors to count. So that's what's called the simple interrupted suture. We make the second suture. Remember, we are going to study all type of injuries that appear in the surgical area. You put the needle holder between the entry point and exit point. Then you count the 3 counts. 1, 2, 3. You clamp the entry point. You just pull like this that you make a knot. You count 2. You clamp the entry point. And you just pull to make a knot. Then use the scissors to count. In the next video, you're going to study about the surgical injuries that appear in the surgical area. Remember the simple one, that the superficial injuries. Then we move to the deep tissue injuries and also the bone injuries. Also, we are going to look infection of the bone. 1, 2, 3. Commonly known as osteomyelitis. In different areas, in pediatrics, osteomyelitis is different with adulthood osteomyelitis. So we are going to learn the basic skills of medical awareness that you should know in surgical area. And now we complete our simple interrupted suture, which we use in the superficial tissue injuries. If you see a patient has just appeared with a superficial injury, just use a simple interrupted suture. But if we move forward to the deep tissue injury, like the muscular tissue injuries, then we are going to use a different pattern. We call this simple interlocking pattern. This is able to hold more tissues because there is a larger tissue that are injured to help them stay in the same pattern. It's not the same like the superficial one. So we are going to use a different pattern that is going to hold more tissue, which is called the interlocking pattern. You take your suture, then remove the injury. Remember, this is for learning purposes. Don't use real patient to learn some basic skill like this. Just improvise what you can to avoid injuries. So we are going to start with the first incision. You put the needle between the entry point and exit point, and then you count 1, 2, 3, few centimeters, then you clamp. This time you have to put the knot at the right side of the surgical area, so that we are able to interlock this pattern. Then you come again, you count 1, 2, you clamp, then you finish with 1. Use your scissors to shorten the tail. when you have folded your needle to the right side, come to the opposite side and make the same pattern with the tail on the back side so that you can interlock. Now you can see you have interlocked your suture. You move again, on the back side, and now you see you have moved to the interlocking pattern. Take your needle again, make this pattern, interlock, come again. This pattern, remember, is used to treat deep tissue injuries like a muscular tissue injury. Then after reaching this part, you just come to the opposite side. Then you interlock. After that, you come to the opposite side again so that we can make our last knot like this. Then you fold. Look careful for the last knot. You have left something looks like this. You count 1, 2, 3. You clamp, you do like this. The other one you count 1, 2. You do like this. And the last one, 1. Use your scissors to make sure that you have left a smart pattern. Now we make the second stage of interlocking pattern in deep tissue injuries of the muscle. Welcome. I'm done.